stood before a similar audience as today on World Cancer Day 2014 when, as Francesco said, the European Cancer Concord, which is the organisation that I represent, in close collaboration with ECPC and also other patient groups, launched the Bill of Rights. Today is a further step on our journey as we fight for those rights for cancer patients in Europe. The document that I hold here today really highlights the specific disparities that are so significant and that European cancer patients face every single day of their lives. I want to share with you some of the outputs of the work that we've done in this regard, but more importantly, what are the patient-focused solutions that we suggest that can improve outcomes for European citizens. In the minute and a half that I've been talking to you, 5 European citizens have already died of cancer. The disparities that European cancer patients face are many, and there's a list of them, and you can read the document in detail, but I just want to pick on a few examples. I cannot underestimate the role of accurate, up-to-date information that is available to the patient, but that is also understandable to the patient. For too long, we've had information being provided to the patient that is not patient-centered. The patient is no longer a passive recipient. The patient is an active participant in his or her care. Therefore, we need to be presenting this data with patient output, or sorry, I should say patient input, in a way that patients can understand. The variations we see in cancer screening and early detection across Europe is really a cause for worry. We see fragmented services. The negative impact of austerity measures have also impacted and really have compromised our ability to prevent the preventable, as evidenced by the high mortality rates for cervical cancer in both Romania and latterly in Greece. If we looked at the last oncopolicy session that just finished there earlier, this unequal access to curative cancer treatments is not just in Eastern Europe, it's across Europe. We're all suffering from these disparities in access to appropriate surgery, chemotherapy, radiotherapy, innovative medicines. In my own country, it leads to the farcical postcode lottery situation where you live depends and determines the quality, or in many instances, the lack of quality, of the delivery of cancer care to our patients. In his speech yesterday, the Commissioner highlighted that 25 out of 28 EU nations have a national cancer plan. What we would like to ask is, how many of those national cancer plans, 1, are actually fit for purpose, and 2, are appropriately resourced? As Richard highlighted, poor governance, major organizational, structural, and fiscal deficits in health planning are underpinning a problem that we really need to look at because they are undermining an effective cancer agenda. The end of cancer treatment does not signal the end of cancer care. Cancer rehabilitation and a return to normal living represents an increasingly important component of our commitment to the cancer patient. There are over 14 million cancer survivors in Europe. I would suggest, as would we all on the panel, that we are not doing enough for these European citizens who have lived beyond cancer. All aspects of the individual's well-being must be considered, not only the physical effects of treatment, but also psychological, social, and economic needs and determinants. You've heard about some of the inequalities. What I now want to do is just focus on some of the solutions. There are a series of recommendations in your pack. I'm not going to go through them all, but I just want to highlight a couple. Developing comprehensive cancer registries. We need to know what the situation is and drill down to that situation in each European country. Otherwise, how can we plan to actually deliver optimal services for our patients? I've already focused on cancer health literacy. That should be a patient-enabled European public health priority. We need to prevent the preventable, remove the barriers that many European citizens face in accessing appropriate levels of screening and early detection. We need to think about reducing the inequalities in both the availability and the access for two of the therapeutic interventions that actually cure the majority of our cancer patients: radiotherapy and surgery. We need to look at the shortages and address them in the availability of cancer medicines, but also facilitate both access to life-preserving and life-enhancing therapeutic interventions by harmonizing a European health technology assessment. And I think it's very clear that we really need to develop a proper, appropriate, and resourced cancer survivorship plan. In the umbrella of all these different requirements that really are critical to improving outcomes for cancer patients, we suggest that implementing these recommendations would be achieved by the establishment of a patient-centered, solutions-driven European Centre for Cancer Control. To finish, imagine if I was speaking to you in 2050, and despite all the warnings, all the information, all the data, all the publications, we have let the current Europe of disparities in cancer persist. This criminal lack of action, coupled with the increasing age of our population in Europe, means that a cancer patient in certain parts of Europe will die every 5 seconds. So I've been talking to you for about 8 minutes. In that time, 100 people have died of cancer. We can no longer tolerate these disparities. The time to act is now. Thank you very much indeed for your attention.